Evening all, welcome. Thank you for joining us this evening. It's great to see all the faces and all the names. Thank you for joining us and welcome to this very special event. Welcome to the Richard Hughes Memorial Lecture organised by the Faculty of Homeopathy. For those of you that don't know me, my name's Dr. Gary Smith. I'm the president of the Faculty of Homeopathy. I'm a medical doctor, I'm a GP, and I practice integrative medicine, and I integrate a range of different lifestyle and holistic approaches alongside my conventional practice. My core discipline, of course, is homeopathy, and I use a lot of homeopathy within my practice. Well, as most of you are probably aware, this event is a long-standing tradition of the faculty. And we've held an annual Richard Hughes Memorial Lecture for many years. And our speaker this evening will no doubt tell us more about Dr. Richard Hughes. But for those of you that don't know, he was a medical doctor who lived a long time ago and practiced homeopathy and advocated a really integrated approach to medicine. And he was also past president of the Faculty of Homeopathy. He was I was reading just earlier on this afternoon, he was the 9th president of this organization, and I'm now the 81st president. So that gives you an indication of how long the organization has been talking about Richard Hughes. Such has been his impact on the practice of homeopathy. So it's a tradition that we value, and we usually hold the event, of course, face-to-face at a venue in central London. And usually we're able to, mingle with each other and enjoy each other's company and have a glass together and discuss the subject and have a really good time together. And it's such a pity that, as you know, we haven't been able to do that. And we really miss that face-to-face interaction that we all enjoy. So this year we're holding it online instead. And as it turns out, it looks like there probably will be more people attending this evening than maybe would have attended face-to-face anyhow. So perhaps there are some advantages to online living. Anyhow, I'd like simply to welcome everyone. Give a very warm welcome to, firstly, those of you who are members of the Faculty of Homeopathy. And I'm looking down and I can see lots of names and faces, and you've been faithfully attending this event for years, and thank you very much for your loyalty and your faithfulness to the organization and for coming again this evening. Also, a warm welcome to members of the College of Medicine who are joining us this evening, and also if you're a member of the NCIM network. Or indeed, if you're not a member of any of those organizations, all are welcome. This is a public event, and you're very welcome. And if you're here at your first Richard Hughes Memorial Lecture, I hope it won't be your last one. And hopefully we can meet face-to-face next year. So our speaker this evening is well known to most of us, if not all of us. And I'm absolutely delighted to introduce our speaker for this evening's Richard Hughes Memorial Lecture as Dr. Elizabeth Thompson. Elizabeth trained in medicine at Oxford University and completed her clinical training at Guy's Hospital in London. She qualified in palliative medicine. She obtained membership of the Royal College of Physicians and then membership of the Faculty of Homeopathy, and then her certificate of completion of specialist training in 2000. She worked as a consultant in the NHS for a number of years and was closely associated with the former Bristol Homeopathic Hospital. And Elizabeth is actually the key person, the key connecting person that connects all of these organizations that I've mentioned. Because she's been a member of the Faculty of Homeopathy for many years, and she's occupied various different roles within the faculty, including vice president for almost a decade, I think. She's a well-known teacher, an educator, and she leads the teaching at one of the faculty's accredited teaching centres in Bristol. She's also a council member of the College of Medicine, And then in 2014, she established the National Centre for Integrative Medicine in Bristol. And throughout that, she has brought a renewed and passion and discussion about the advantages of pursuing an integrative approach to medicine. And really, she's been at the forefront of developing integrative medicine as a discipline in its own right. She also continues her clinical work. She's a very experienced clinician and medical homeopath, and I think she specializes mainly in women's health and supporting the health and well-being of cancer patients. So, as if that wasn't enough, I thought I was busy. She's also a board member of the European Society for Integrative Medicine, and she's the president of the European Congress for Integrative Medicine, coming up in London later this year, hopefully. So her subject this evening is entitled "The Big Ship, Integrative Medicine, Is Homeopathy on Board?" I'm sure you'll agree this is a very timely question and a very topical subject. And I'm looking forward to hearing the presentation. From my point of view, I can't think of a more holistic and more whole person approach than homeopathy. And the patient-reported outcomes that have been shown over the years have demonstrated the real value and benefits of integrating homeopathy alongside conventional practice. However, I look forward to our discussion and to the presentation and to our discussion afterwards. Could I ask everyone just to mute your microphone during the presentation? And if you have any questions for Elizabeth, feel free to enter them into the chat box, and we will have a Q&A session at the end, and hopefully we'll put those questions to Elizabeth at the end and have some discussion. So thank you once again. I'll not say any more. Without further ado, I will hand over now to Elizabeth. Thank you.
Thank you so much, Gary. That was a fantastic intro. I've never heard my life roll out like that. It sounds a bit exhausting. It's probably why I have to go to bed at 9:30 every night. But thank you. And it's an honor to be asked to give this memorial lecture. So who is this old man of homeopathy, as he was called? In fact, that beard of his is really quite on trend at the moment. The beards were even bigger, but I chose this one. And Richard Hughes, every year we kind of honor him. And in fact, he created a lot of controversy within homeopathy. And I want to really talk about that and look at why that might be. So just to remind ourselves, we've got a very mixed group here, but the use of very low doses of highly succussed natural substances, which when well matched to the individual will stimulate the vital force into a self-healing or self-regulating response. So there's a lot in there, and that picture is the beautiful belladonna, full of atropine, dilating eyes, making a woman look very beautiful. And we know this plant as part of the Solanaceae family, and find it incredibly useful in our clinical medical homeopathy practice. So what about Richard Hughes? He really wanted to make homeopathy acceptable. And he said it's necessary to understand the pathology created by the remedies on the organic level. And it is the pathology level which has to be treated. So you could really see him trying to bed this thing down, make it very tangible. But one critic of Hughes said his concept of low potencies was ideal for those who need not wish to stay far from their allopathic training. So what you see is a division within homeopathic prescribing. And to summarize, Richard Hughes was saying, look, we can prove homeopathy works, but don't bring in concepts of high dilution or the idea of the vital force, as they are not scientific. And he was a very systematized thinker. the editor of the British Homeopathic Journal for many years, which is now still existent, called Homeopathy, peer-reviewed journal. So just for fun, put into the chat whether you think Richard Hughes would be left brain dominant or right brain dominant. What do you think he would be in terms of that left brain systematizing certainty, or would he be flowers, connection, flow, right brain? Just pop into the chat which you think. So I can see that some of you are doing this, and of course he is going to be left brain, and I'm going to come back to this because what we know is the movement across the left and the right brain is so essential, and that the corpus callosum, one of the things the brain loves most is dance. So bilateral movement, information coming in left and right. And we're going to come back to that. But in the meantime, Richard really created a kind of a battleground. And that battleground within the homeopathic community between we believe in low potency versus we believe in high potency was losing sight of the battle outside, which many of us, including me, really experienced with great difficulty. And that battleground actually in 10 years ago, over 10 years ago now, led to me being ill. I actually had swine flu. So if you like, I had long swine flu, not long COVID. But I really came off the rails. I became really ill, and I found myself in a place away from the usual structures. And if you like, looking at the resilience of wanting to be this little ball in this safe little cove, I had flipped over my latitude out of the zone of precariousness and into real difficulty, where my body was challenged on a day-to-day basis. So I found at that point that I really started to understand integrative medicine, because these are some of the things I needed. Rest exclamation mark was there. I was lucky I could afford a lot of approaches, and I can't say that any one of those approaches I could have left out. So using integrative medicine and being fortunate enough to do it, I also, out of that time of great difficulty, began to realize that I needed to do things differently. So this was some of the artwork I did at the time, and I referred to this as pupating, just realizing, okay, I'm not well. I've never been off work in 25 years of being a doctor, but here am I, and I just have to accept and maybe change. And I did find more balance, but I also realized that the organization I was in at the time, a busy NHS service, where I was trying to innovate holistic healthcare, I was under fire by the skeptics. And I guess that experience of powerlessness, that is a problem. And I'd like to also raise to you that that's been part of the problems for us as a homeopathic community, and maybe really looking at that. But digging deep, I found myself then, and obviously supported by serendipity and various people, setting up this social enterprise in 2014 to deliver one-to-one services, inspiring health and well-being, but also to support a transformation of healthcare through education and building a like-minded community. So what is integrative medicine? It brings together conventional lifestyle and holistic approaches. And this should be in a very respectful model where we really do appreciate each other's contribution. Wellness and resilience are absolutely core concepts, supporting balance and vitality, optimizing health, reducing disease risk, but not waiting until people get ill. And it's an empowered model offering diversity and choice to both patients and clinicians. And as you can see, it has an awful lot of approaches. So one of the things that we began doing quite early on was to set up a new Master's Level 7 2-year diploma in integrative healthcare. And what was interesting is that including these holistic approaches along with lifestyle and conventional understanding really started to cause problems. There were people who wanted to work with me, but only if I left homeopathy out. And one of the things that I felt was that homeopathy was important, but so were these other holistic approaches, that lifestyle is crucial, as we know, but there's something about these holistic approaches that could be really important. So the 2-year Masters is a program, a modular program, looking at the philosophy and history of integrative medicine and medicine, looking at approaches and conditions, holistic consulting and the therapeutic relationship, research and critical appraisal, holistic management, including connecting to social prescribing, looking at dynamic practice, leadership, more approaches and how they might be applied across conditions, and then looking at innovation. And it was when that I started to pull together the approaches that some really interesting themes seemed to emerge for me, drawing on other philosophies of health. And we'll talk in a minute about this yin-yang symbol. But Ayurveda, traditional Chinese medicine, naturopathy, homeopathy, they had a lot in common. And why might they be important? Well, Hippocrates was really clear, the forefather of medicine, that the disease could not be treated without an understanding of the whole. So whole system approaches have a particular element that is very important. So again, this yin-yang image, this is a very ancient one from Lao Tzu, who wrote about Taoism. And you can see the yin, the dark nighttime, the rest and restore. And just in the middle of the darkness is the white spot of the yang. And the yang is the sunlight, the male principle, and the yin being the female principle. And again, we come back to these principles in nature that could be really important if we're trying to explain human experience and human vitality. So, drawing on ancient philosophies, I was fascinated to find that in the 4th century, a Chinese doctor was recommending yellow broth containing feces. We would have thought that's the craziest idea, but in fact, we're now giving capsules to people to give them a feces transplant, realizing that bowel health and probiotics are so important. Suddenly, the fasting and detox of Ayurveda suddenly become really important as we realize that fasting helps longevity. It also helps us repair. So these approaches all had a theme around finding balance, activating energy and vitality, and removing blocks to flow. So somehow, although very understanding of Richard Hughes's approach and his need to be accepted, if we remove the idea of the vital force, then a lot of the whole system approaches become quite challenging. Energy and flow, here we've got the 5 elements, the metal, the wood, the water, the fire, the earth of traditional Chinese medicine. We have the prana, the great breath, the in-breath and the out-breath of all things. And also the idea that we as humans are part of a greater consciousness. And within the diploma, we teach Ayurveda, we even do the 7 chakra meditation. I would recommend it, Deepak Chopra, if you haven't done it. You know, the root chakra, the Muladhara, up to this crown chakra. These are ways of looking at our bodies as energetic systems. So vital energy, flow, balance, connection. And yet, if I'm giving a talk about integrative medicine, the way I can lose rapport is to mention energy. And one talk I gave was hijacked when I mentioned energy, even though we have this natural sense of, oh, I'm feeling more energetic today. So this is a problem, and I want to just explore it a bit further. So Samuel Hahnemann, who developed homeopathy, this was his definition of the vital force. In the healthy condition of man, the spiritual vital force, the dynamis that animates the material body, rules with unbounded sway and retains all the parts of the organism in admirable, harmonious, vital operation as regards both sensation and function, so that our indwelling, reason-gifted mind can freely employ this living, healthy instrument for the higher purpose of our existence. And even today in my clinic this morning with a university professor with long COVID, I was talking about health equating with freedom. And fortunately, she was feeling a lot better and was even beginning to forget that her bedroom had become a place where she felt haunted. And so working with her, and we'll talk a little bit about how to combine these different approaches and how important they can be. I lead on the holistic consulting within the diploma, and everything I learned about homeopathic case taking informs these principles of working with complexity and depth, empathic listening, the unprejudiced observer, unconditional positive regard. That's what we do when we place ourselves in that non-judgment. Connecting to what's important to the patient, connecting to wellness, healing, and crucially to a diverse range of interventions, because we have to acknowledge that sometimes homeopathy isn't enough, or it isn't what that person might be needed. Again, this holistic assessment tool that we developed was very much developed from homeopathic case taking. The 3 Ps: predisposing, precipitating, perpetuating. Why now? What's the background here? This is so important, this timeline. And with homeopathic case taking, we're taught to do that. But with holistic consulting, and not always focusing on homeopathy, but seeing the broader picture, these are models that can really work for people. And I have to say, when we invited one of the functional medicine clinicians in to teach on the diploma, I was really impressed with some of the materials they use. And here you see the 3 Ps said in a different way, with antecedents, triggering events, mediators, perpetuators. But here you've got modifiable personal lifestyle factors. And I was really excited to be asked to chair a session in integrative oncology about 3 weekends ago now, where an oncologist from the UK began and opened the day, and then an oncologist from the States ended it. And both said, if you are not using an integrative approach as a clinician, you are behind the times. So this is an incredible movement for change, which feels pretty unstoppable. So if we focus again into homeopathy and concepts of wholeness, the ideal homeopathic stimulus is one that does relate to the whole. Hahnemann was so clever. He talked about the totality of symptoms. And in homeopathic case taking, we're recognizing these symptoms across mind and body. And then crucially for us as homeopaths, pattern matching. How do we pattern match the constellation of symptoms, looking up in the night sky and seeing belladonna, seeing pulsatilla? And these constellations, helped by software programs and clever ways of understanding, still connect us to a substance in nature, which we believe is a unique friend to that person. And that's when it gets a little bit strange. So we might be diving deep and finding the starfish, Asterias rubens, part of the sea creatures, or our beloved friend Pulsatilla, this timid flower that we can imagine some of the feelings of sensitivity that it might have. And this is where we get excited, you know, when we're pattern matching and finding a medicine that really suits. And yet these substances from the natural world, borax, tarantula, the Rosa damascena, there's a wonder, there is a mystery in why we as humans are connected. And so one of the controversies that I think we've experienced in the homeopathic community, again, really relates to Richard Hughes, because if you think of Richard Hughes really wanting things to stay in that level 1, level 2, what he called the pathology, the name of the disease. And what we've been realizing is that often we got stuck in level 3, and that was always difficult as a medical homeopath, because we might listen to someone for an hour, but they might, you know, cry for 55 minutes, and we would cry because we wouldn't know what remedy to give them. And so going deeper, and Kent was really clear about this, and Kent and Hughes began to kind of have this division, because Kent realized, you know, that the person, and I've heard this said to me, you know, I would sit on the steps and not know whether I was part of this family. And I would say to my mum, am I adopted? And she'd say, don't be stupid. You're not adopted. You know, you're my child. But her delusion was of an orphan. So magnesium carbonicum, delusion, he is an orphan. And then Sankaran really evolved our understanding deeper into the vital sensation of the substance in nature, and even deeper into energy. And as I say, this is a mystery. This is, by the way, on the left is a fractal pattern. The idea of putting an equation in a recurring fashion will create shape and form. And for any of you reading Entangled Life about mycelium and mushrooms, or The Hidden Life of Trees, we're just learning about the way nature connects to each other. So learning about how a mother beech tree will parent a baby beech tree for 150 years. So again, this is science that is telling us that we live in an extraordinary universe. And I know that there was some news last week that we may have got a bit closer into dark matter, but the truth of it is that we really still don't know what dark matter is. So I'm aware of time, but I'll move quickly through. But what I wanted to mention is that the science is important. And I began researching with David Riley here in Glasgow in the Centre for Integrative Care. And my thesis, as it became, was looking at cancer patients, looking specifically at women with estrogen withdrawal, then doing a pilot randomized placebo-controlled trial, which certainly did tell me about research, but it also told me about the placebo and the psychology of hope and what's possible when we're given a pathway to healing. Some of the research is just being published, which is exciting. This is a study by Michael Frass, the professor in Vienna, showing that a randomized placebo-controlled double-blind 3-arm multi-center study of add-on homeopathic treatment to improve quality of life and survival. This is really exciting to see this, as was this positive double-blind trial of a reduction in seroma with Bellis and arnica for those women undergoing breast cancer surgery. So integrative oncology, my path through integrative oncology has been helping to reduce side effects, problem symptoms, but crucially engaging hopefully with those people with advanced cancer. So just back to integrative medicine, for me with integrative oncology, nurturing the soil of the body through lifestyle, nutrition, green spaces, mindfulness, mistletoe, homeopathy, acupuncture, there's never anything that we get to a point where there's nothing we can do. We've also really been communicating with the public to empower them. When we do our Holistic Doctor webinars, we look at the physiology of sleep, top tips from the IM toolbox. For example, trying to wake up at the same time every day, staying with your circadian rhythms, understanding the sympathetic and parasympathetic nervous system, looking at nutrition, omega-3, antioxidants, magnesium, so important for sleep and rest, but also melatonin, one of our amazing hormones that increases the day goes on and helps us sleep. So these are all important, and not forgetting our lovely list of homeopathic medicines, which we would all know, or sometimes we might try an individualized medicine. So are we ready to jump on board the big ship integrative medicine? Richard Hughes gave us so much, we're still remembering him now, and he wanted a foot in each camp. But how do we really communicate across the organizations, but also keep the idea of the sword, the masculine, the rapier thinking, cutting through, but holding the chalice of healing, of flow, of acceptance, of non-judgment? The combination of these factors are so important. And so just back to the tree, where we're rooted, as Richard Hughes was, but also where we are connecting to the sky as well. So what I'm learning to do is to celebrate myself as a homeopath. Even a couple of weeks ago, I had to say, I can't chair a session or talk about integrative oncology if I don't talk about homeopathy, because that's who I am. And by taking a stand, I thought I would have to pull out of the conference, but in the end, they said, you can do it. So let's celebrate becoming the unprejudiced observer, honoring the head, the heart, the gut, creating the environment for the deeper inquiry, holding uncertainty, connecting to the person, ourselves, and to nature, and believing in the potential for wholeness and healing. So you may want to join us in November at the European Congress for Integrative Medicine. I'm president, one of 5 presidents. But do join us. It'll be a wonderful opportunity to share across this very diverse body of knowledge and practice. Just the month before, October the 22nd, is the Faculty Congress, which will be online. So many opportunities for us to connect. So I'm going to hand back over to you. Shall I stop sharing, Gary, so that we can bring everyone back into the Zoom room?
Yes, that would be good. Thanks. Thank you, Elizabeth. Wow, that was excellent and thought-provoking. We have some time for some questions and discussion. I don't see any questions in the chat box. So let me open this up to everyone, and feel free to unmute yourself. And if you do have a question, if you can either type it in the chat box, or I'm happy if you want to unmute yourself and ask a question, and let's start some discussion.
Hi, can I ask a question, please?
Yes.
Stella, unfortunately, you can't see me. I have trouble with my video.
That's fine. Maybe you could introduce yourself and
yeah, okay.
let us know where you're from.
Thank you. My name is Stella. I'm living here in London.
Great. Very welcome.
Thank you very much. I work as a holistic practitioner. I know that's a broad name for everything that we do. Can I just double check with you? The conference in November, is that online, or is it held? Where is it held?
So Stella, we're just deciding at the moment, but it's very likely that it will be a hybrid, so that we will plan to meet together. The organisers, Progressive Communications, are actually just putting word out to find out how many people would attend in person. But, you know, it's a difficult time for people, but we do feel that people might also have the appetite to physically meet.
Wonderful. Thank you.
Thank you, Stella. Anyone else got any questions? Yes, Edward.
Hi.
Hi.
Yes, thanks for that presentation. I wanted to pick up on your mention about energy, and I agree completely. We have to drop the word energy, get rid of it. We can by information and things like that. That's probably where that we're all doing in information and medicine, whichever way we're doing it. But I completely agree on that, and I've been trying to battle for this for a few years, but a lot of our colleagues don't open their ears. So please spread the word, drop the word energy. We're not doing energy medicine at all. We're providing information to the patients, and I think that is how we have to move forward.
So I wasn't suggesting we did drop the word energy, but just that it was contentious. I wonder if the word vitality is better, but maybe the audience might like to, you know, say what they think about that.
Yeah, it is actually talking about what our medicines do, what our home medicines do. They don't bring energy to the body. They cause a reaction which might allow the energy to free its current again. But we have to, I think it's a real contentious thing, this energy medicine thing. It makes us sound really weird, and I think we have to have a discussion about that.
Yeah, interesting question, interesting point, Edward. Yeah, I don't disagree, but at the same time, we are stimulating the patients through our intervention. We're stimulating the patient's natural healing ability, if you like. But yes,
Brad has his hand up.
Yeah, I think Jackie had her hand up before me.
And I was just going to suggest a word. I was going to suggest well-being. I mean, we just came to that conclusion talking to loads and loads of much younger people, users of Twitter and various things, and saying wellness and well-being seem to be much more acceptable.
Yeah.
Well, I was going to say, surely a lot depends on definitions, because the word energy is actually being increasingly used in a traditional sense. For example, the NICE guidelines on chronic fatigue with energy management systems, advising, or energy is an integral part of biodynamics and plant health, energy systems, primary metabolism. So surely we can own the word energy and strip of it any quackery.
Can I just say, I find that really interesting, because our whole complete bodies are run by energy, and that's electrical energy. So it doesn't matter what system you're looking at, it's an energetic system that is reliant on the energy of one system to support the rest of the whole. So I totally disagree. Maybe not the word, and it's maybe a mental block within, you know, within want to hear anyway. I mean, I'm a professional homeopath. I don't have a medical background, but when I get patients, most of them have spent years going through the medical system and come to me as a last resort. And I think homeopaths that work like I do actually get the raw end of the deal, in that we land up with people who've not had an answer anywhere else, and to then ask them to go back to their GPs to get the blood tests, to get these things, or to suggest that they look at whatever it is that you feel is being bypassed or ignored, is a big ask for a homeopath to get patients to do that, and it's very difficult. And I think the more we get everybody to work together and to actually value and appreciate what we can all bring to the table is the way to go. And that's all
Could I just add, millions are being pumped, or pounds, billions perhaps, into discovering or looking at free dark energy, or even more novel energy particles. So why can't we revamp our terminology and retain the use of energy?
And just to say to Jackie that also with our diploma, we opened it up to CAM practitioners along with healthcare professionals statutorily registered, because we felt that we wanted to create this middle ground for people to really support each other, learn from each other in these professional arenas in healthcare. So I think it continues to be a challenge. And what's interesting is we have a lovely mix coming into this new year of, we've got 2 pediatric surgeons, we've got GPs, but we've also got a shiatsu practitioner, a health coach, a teacher. So it means that we can have really great dialogue like now about how do we work across this divide.
Thank you, Jackie. We've got Jan and then Jane. Jan.
Hi, I'm Jan Hurst. I'm a homeopath. I live in Brecon Beacons. This is where I work from. Just on Edward's point, I disagree quite strongly. I think we are dealing with energetic medicine, if you like. It meets patients at their level, and most of my patients talk about their energetic levels as well. So I certainly don't think that we should take that away from our work at all. And just something that Jackie picked on there, I don't think we should look at it as we're sort of the last person that come to visit. I think that's actually the beauty of what we do in our work, because yes, people do come, they'll say, I'm really desperate, no one else has helped. But I think that's a gem in itself, isn't it? And if we can all work and integrate together, that's even better. But I think, yeah, what we do is can see it as the bottom of the pile, certainly. Thank you.
No, absolutely, completely agree. Jane, you're very welcome.
Thank you. So Jane Sterland. So I'm here as myself, but I'm also General Manager for Valeda in the UK. Really great presentation, Elizabeth. Thank you so much.
Thank you.
My question to you, and to all of us, but specifically to you, is do you think the tide is turning back towards homeopathy?
Do you know what? I do. And I think that the tide is turning now for integrative medicine. The public have got it, they want it. Young doctors now are, you know, in Bristol University, they set up NutriTank so that nutrition would become mainstream in their training. But so many of them are training in yoga, Ayurveda becomes part of their life, and also the concepts of energy, which is really interesting. So as things move, I feel if we are on board, we will just move with this wave. And I still have to, you know, as I said, in this conference a couple of weeks ago, I had to say, I need to be able to include homeopathy. But what was interesting is the organizers contacted and said, yours was the best session. And it was because I worked around supporting an individual in her, you know, telling her experience. So I feel that, and sorry, I'm not meaning guys here, but I just feel the patriarch has been in charge for a long time. And what I mean by that is this top down, we know what you need, we know what's right and wrong. So Jane, I feel it's really exciting because homeopathy is useful and people know it's useful and they use it, but it's just been out rather than in. But with this movement for change, I believe it will be part of an incredible mix of things. But homeopathy is so elegant, so safe. You know, oncologists still like it because they know it's not going to interfere with the chemo, with the radiotherapy. So yes, I think yes.
Yeah, and I would agree. And I think I would just add that I think there was a lot of negative energy surrounding the whole quite aggressive campaign that was waged to get homeopathy out of the NHS. And I think that generated a huge amount of negative energy. And whilst there are still those of us, myself included, that continue to be able to prescribe. I think since that whole sort of episode has come to an end in many places, that I think that's helping the tide turn, actually, because there's still enormous patient demand. I don't know if anyone's on the call from the pharmacies, apart from Jane, of course, and Juanita, but the other homeopathic pharmacies. But from what I can hear, the demand's never been higher for homeopathic medicines. So there's huge patient demand, and certainly that's been our experience from a practitioner point of view. So hopefully the tide is turning. Zoisa and then Jane Mills.
Hi, thank you very much. Thanks for the talk, Elizabeth. That was really lovely to hear. I'm one of the people that's enrolled on the integrated medicine course. So my background is Pilates as well as kinesiology. And I think for me, what's really fascinating and interesting is with homeopathy, it's very subtle in terms of, and then sometimes not so subtle in terms of how it works. And so I'm finding more and more when people might come to me with a backache, or usually it's something musculoskeletal, but like one of the other ladies here was suggesting, is it's all the systems are interrelated. So whilst you might want to strengthen your back muscles, it's like, well, you have to boil down to, well, why is that happening? And again, the idea of looking for is there a pattern? And I feel more and more people are becoming much more open to, well, you know, I don't just want one thing. It's just like, look at the bigger picture and how can I use what's available out there so that I can kind of cherry pick appropriately for that client, that person, because there is no one thing fits every different solution, because we are all individuals. And I think this is where, you know, particularly homeopathy and some of the other ones, it's like you can do that and people feel that they then can take charge themselves, and education, I feel, is a huge part, so that people are much more aware and know that how they can help, because people want to help themselves.
I so agree. People want to help themselves, and they want to avoid being on 12 conventional drugs by the time they're 74. So we run a module for the medical undergraduates called Optimum Health for Later Life. And, you know, as nobody wants to get ill, do they? So, you know, it's so important. And Gary, just to say, Marlies has had her hand up. Sorry if I haven't got your name right, but just to say that she was.
Okay, sorry about that. Shall we go Marlies first of all, and then Jane Mills after that? Marlies.
So thank you very much for that presentation. I also have to strongly disagree about the use of the word energy. I think it's absolutely central to homeopathy. You only have to read the organon from cover to cover to know that it is energy. And having worked at both Helios and Ainsworth for a number of years when I was a student, when you make the homeopathic medicines, beyond the 6C, there is no single molecule of the original substance left. So therefore, we are only talking about energy. That is what it is. And we can't shy away from that. We do have to actually stand up and say, no, I'm sorry, this is energy. And we know that, you know, you can bring a profound effect with a 1M. That's 1,000 dilutions. That's way, way beyond Avogadro's constant. So yes, I have to throw my hat in and say it is energetic medicine. Just one thing that I wanted to also mention is I hear people talk about medical homeopathy, and I don't really get it. I mean, I've been a homeopath for nearly 30 years, and I don't know that there's any other type of medical homeopathy. Now, I understand that there is the division between the society and the faculty. I don't think we as a community do ourselves any favors if we say medical homeopathy as opposed to what. So here's my little plea. Can we just talk about homeopathy? Because that's what we all do.
Well, that's a nice controversial thing, because we've all been agreeing with each other. I guess medical homeopathy does, for some people, they do want someone who understands their clinical condition as a doctor. And I know that because, patients get to me and they say, I'm so glad that you understand all of that and can prescribe homeopathy. That doesn't stop the professional homeopath doing incredible work. But when things get very complex, like they often do in cancer, it does just, again, some people may choose to go to a medical homeopath, and that would be the difference.
I completely understand that. I just think rather than skirt around the issue, we should be upping the levels of education. Kind of taking the bull by the horns and say, right, let's sort this out properly, but also for statutory regulated professionals who do a very part-time course in homeopathy. By the same token, they need to raise their game, because there are lots of homeopaths like myself who've done a 3-year full-time course in pure homeopathy, followed by a 2-year postgraduate course with Jeremy's, Dynamis School, and have a lot of years of amazing homeopathic education, which doesn't necessarily stack up to the part-time courses that are available for others. So, that's something that I feel we have, as a profession, have to address.
And I think this idea of being well qualified to deliver care and professional is something that I've noticed. If people are doing that, their practices thrive, because again, I feel the public are very astute. They kind of know when someone's good. And just to say that with my work with the diploma, I've now met some amazing naturopaths from the USA, trained really well, a bit like Heilpraktiker in Germany were, but then they get to the point where they stop training in pharmacology and train in naturopathy, but they still have clinical attachments. And we thought this might have been possible 20 years ago, but you never know, it might be possible again, so that homeopaths can train in different ways but have clinical experience.
And I also agree with whoever said I do agree that the younger medical students and younger doctors are much more on board with the concept of energetic medicine. We're all familiar with acupuncture, and I think that the younger generation of medically trained doctors are much more au fait and comfortable with that expression than maybe older necessarily educated themselves in integrative medicine and other holistic systems of medicine.
I agree.
Thank you.
Jane Mills has been waiting a long time, and then with a feeling.
Not a problem whatsoever. That was very interesting. I really enjoyed the conversation there, and thank you very much, Gary and Elizabeth and Jane Sterland. Well, my own professional was I was a general nurse, midwife, occupational health nurse. That's my discipline now, and homeopath within the Northern College of Homeopathy and also the faculty. But I'm a leader health advisor with Jane Sterland. So I've got my finger in lots and lots of pies. And what I do now from my own personal practice is, certainly through COVID, I've never stopped working. I've never, ever been so busy in my whole life, with lots of people wanting assistance because they've actually not been able to access help. And I've been so grateful for the medical knowledge I've acquired over the years. And I've actually used it in lots of instances to be able to direct people in directions where they need to go. So they've been able to get assistance. And one of them has actually been through Weleda. Weleda have actually been super special and so supportive in so many directions. I can't express my gratitude to them, for myself, they have been absolutely awesome. And from the homeopathic perspective, they have really upped their game, something terrible. And also, but terrible as in a really good remit, I have to say. And from the energy point of view, I think that it's, personally, I think it's a really important thing, because even in nursing, and patients' concepts are, they come in and they say, my energy is so low. My own energy is low, and they actually equate to energy. It's not vital force. It's not physical. I agree with the vital force within homeopathy, but it's, people talk about energy, and their energy is low, and they want to actually have it revitalized. So it can be integrated in so many different ways, especially emotionally, especially in this particular time. Everybody's feeling the of it all.
Yeah, I think that's true, Jane.
Really important.
And if we're doing lots of a big thank you to Walida as well, who've supported the diploma with bursaries, because it's, you know, when people reach out to do these extra trainings, the support they get can be the difference between someone being able to stay on a course.
Yeah, but I have to say the online support has actually been better through COVID in all ranges within acupuncture and homeopathy. I've never seen so much support coming through ever in everything I've been doing, and I've been doing it over 40 years. So it's really, really good, and you know, it's, everybody's jumping on board, so it's lovely.
Great. Gary, are we out of time, or are we good?
We're slipping out of time. I thought maybe with 3 people with their hands up, and these probably will need to be the last. Charlotte, Jessica, and Corinne. And I'll just have a quick look at the chat box. But Charlotte, over to you first of all.
Oh, thanks. Well, thanks, Elizabeth, for a fantastic talk. I was actually just thinking about how I've been thinking about homeopathy and integrative medicine recently, and thinking that they are like 2 wings of a bird by which you've reached healing, whereas one wing being homeopathy and the other being, I guess, if you like, lifestyle changes, in particular diet. But anyway, but I think your presentation was a lot more comfortable. So I guess I do have a question, which is, with sort of functional medicine practitioners and doctors becoming so kind of powerful, as it were, or gaining in strength and followers at the moment, how do you think we can get them on board to acknowledge and appreciate homeopathy? Maybe you've done a lot of that yourself, but and with your courses, but when I have spoken to people in the past, you know, functional medicine practitioners, and I'm also involved in something called plant-based health professionals. Yeah. They don't seem terribly interested, I have to say. It's sort of a bit of, you know.
Well, I suppose it's a really important area, Charlotte, because the functional med, their last conference, I think they had 369 attendees. This was before COVID, and many of them were doctors. And I think that one of the functional medicine that we teach in this much broader, diverse model, but with functional medicine, you've got this, you know, as I showed you the matrix of a very elegant consulting style, but then often connecting to much more certainty or perceived certainty about metabolic pathways. And it was very interesting, you know, working with someone jointly who's trained in functional medicine, and myself working with a colleague who'd got ill with secondary cancer, that it almost felt to me like we were getting too clever about cellular pathways that we had no idea how they actually functioned in real life. So I guess what I think is things that offer you certainty. I think that we just have to accept that we have more with homeopathy, but not to be fazed by it. I think just to understand what different people are offering. But within NCIM, we probably are going to, well, we're going to advertise for a functional medicine clinician, because that's also what people want. So it's a difficult area, but one that I think, again, I just try and learn from the functional clinicians to, you know, to really hear and respect what they're doing. With the hope that they might respect, you know, it's this thing about mutual respect, isn't it?
Yeah.
Jessica, we'll have to, I think we'll have to keep it brief at this late stage, but Jessica, go ahead.
Hello, thank you very much, Elizabeth. That was fantastic. My question, I'm not going to go into energy because there's no time. My question is, until the revolution when all healthcare will allow an integrative approach, how can we provide integrative care for people with no money?
Boy, oh boy, oh boy, great question. So we have low cost options. We, you know, in NCIM, so that people can access it, but it still costs something. We get charitable money to, we're delivering food for Healthy Heart into areas of social deprivation. We've been delivering mindfulness for cancer online, charitably funded with a sister organization, Penny Braun. You know, one of the things I've noticed with the COVID services, I think COVID has been such a difficult time, but also such an opportunity, because some of those services are much more integrative. So, and they will be delivered free. So I think just need to look, I've just lost our lovely nutritionist to a health coach post in the NHS in Knowle West, one of the worst areas of deprivation in Europe. So to have health coaches now, along with social prescribing link workers, you know, just, I think the time will come, as I say, where this integrative approach, we hopefully can get funding. There's no doubt about it. Homeopathy is still a challenge to get accepted. But look at over 100 people tonight wanting to talk about it. Being online really helps us to connect, doesn't it? And by connecting, we keep us going.
Yeah, you're here. And one thing I would just add to that, I think we've got Crystal with us from Homeopathy UK. So in regard to sort of low-cost clinics and providing homeopathy for those who can't afford to pay for it, then Homeopathy UK is another provider who has got a network of clinics across the UK and are always interested in opening. So if you're in an area, or if you're someone who'd like to work in a low-cost clinic, I'm sure Homeopathy UK would be interested to hear from you. Corinne.
Hello.
Hi there.
Hi. I just wanted to say a couple of things, and I know we don't have much time left, but one was about my journey into homeopathy as a parent of a child with a serious metabolic illness. I came across homeopathy when she was 1.5, and she was already on this drug called diazepam to control her insulin. And so I felt very torn between the two approaches and trying to manage my child's health. I had a brilliant homeopath who was not qualified. I was going to Great Ormond Street and seeing the consultants for metabolic illnesses, so endocrinology. And I felt very torn at that time. I didn't understand that there were medical homeopaths. So I'm really in favor of an integrated approach, and I wanted to support what Elizabeth is saying about homeopaths being well qualified. Yeah, and I also want to thank Elizabeth for her presentation and also some of the papers she's written and that I've read during my training. I did want to say something else, because you're talking about functional medicine and certainty, and I think there's more certainty with acute illness, and RCTs apply better to acute illness, but the majority of illnesses are chronic, where there is less certainty, and less randomized controlled trials don't work so well for those kind of illnesses. I'll just end my comments there, but thank you.
Thank you very much.
Okay, I think we better wrap up at that stage.
Do you want me to share that last slide, Gary?
That would be great. Whilst we're doing that, I see Trish has commented, key going forward is partnership, partners with the patient in their journey of health and empowering the patients. And I see Tina has asked, sorry, there's one more question. Tina has asked, what is the response of patients to the diversity of treatments on offer? Are they accepting, or do you need to encourage them?
Very enthusiastic. One lady said to me this morning in clinic, I think I'm better because everything you said helped me understand and then connected me to a range of approaches. So I think, again, you know, people are really enthusiastic. It makes sense to them for this diverse model.
Thank you. Thank you for the questions, everyone. And one I think we could continue for a long time this evening, but one I hope that we will continue out with this call. Thank you, Elizabeth. That was a really fantastic, really enjoyable evening. Thank you for your presentation and for answering all of those questions. And just a final comment from me, that if you're on the call and you're not a member of the Faculty of Homeopathy, you're very welcome to contact us and discuss membership. And there has been some interesting comments about some of the, what I hope is becoming increasingly historical differences between us all, and our backgrounds. And certainly those of you that are friends with us in the faculty will know that we've been going through our own journey of change. And we very much believe that integration and collaboration are key going forward. And we've been adjusting our membership categories. And fortunately or unfortunately, we do have to work within the constraints of the Faculty of Homeopathy Act 1950, the Act of Parliament that established us. But we've been finding new ways to broaden our membership categories so that we can welcome as many people as possible. And if you're practicing responsible homeopathy and you've got appropriate training, someone mentioned there, but not doing a weekend course, 100% agree, you've got appropriate training, you've got appropriate indemnity, and you're practicing professionally, then I hope that you can find a warm welcome with us at the faculty. If you don't fall into that category, you can always subscribe to our journal, the only journal in the world and that's Medline listed and devoted to homeopathy. And the final thing I would say, as my slide's just gone,
oh, sorry.
that's fine. The final thing I would say is, I know that a lot of you, actually looking at the names, a lot of you had registered for what was going to be our 99th Faculty of Homeopathy Congress, which was going to be in Bournemouth, if you remember, last October. We're all looking forward to that. And the theme being at the beach and the seaside was generating positive waves. And sadly, that had to be postponed. But we are going to press ahead with it online on Friday, the 22nd of October. And the Faculties Congress is another one of these traditions that have been going strong for many years. And everyone's welcome, whatever your background or whether you're a member or not a member, everyone's welcome to attend that. So please do drop us a line. Thank you, everyone. We've run over the time considerably. I hope you feel it was worth it, though. I certainly do. Thank you for presenting the Richard Hughes Memorial Lecture this year. And to everyone else, thank you for coming. Keep in contact with us, and hopefully we'll be able to see each other face to face at some point. So thank you, everyone.